Hello, everybody. My name is Dr. Konrad Sawicki. I am a second-year cardiology fellow at Northwestern University in Chicago. I'm delighted to be joined today by Dr. Dayna Johnson, who's an assistant professor in the Department of Epidemiology at Emory University, and also Dr. Anne Fink, who's an assistant professor in the Department of Biobehavioral Nursing Science at the University of Illinois in Chicago. And Dayna, what are some of the reasons for these sleep disparities?
Yeah, so mainly it's social determinants that are contributing to sleep disparities. And it's really racism or discrimination that's contributing to these different sleep health disparities. And outside of the sleep field, it's known that racism or discrimination are fundamental determinants of health disparities. And again, we're seeing the same thing in sleep. And so there are historical policies that were discriminatory that contribute to the way our environments are shaped. And then racial minorities are more likely to live in these neighborhoods. And then also those of lower socioeconomic status, they're also more likely to live in these environments where they're exposed to inopportune light exposure, excessive noise, and other factors that are known to affect sleep health and also can increase risk for different sleep disorders such as sleep apnea. And then if we think about different occupations, racial and ethnic minorities, as well as those of lower socioeconomic status, are more likely to be shift workers. And they are at increased risk for circadian disruption or circadian misalignment. And this can also alter their sleep as well as health trajectories. Now, I mentioned the neighborhood environment having various features that can affect sleep. But what's important to also think about is it the place or is it race? This is a common discussion in the sleep disparities literature. So it's the factors in these environments that are affecting the sleep of various individuals. And it's that racial minorities are more likely to live in these adverse neighborhood environments. Now, sleep disparities are likely driving overall disparities in health outcomes, and particularly in cardiovascular outcomes. We do have some evidence that shows that sleep partially mediates racial differences in cardiometabolic health. There's a study from the MIDAS cohort. And then also that sleep partially mediates, the racial disparity in diastolic blood pressure. And this was seen in the CARDIA study.